Okay, I know what actually happened. That's enough. Okay, so I'm testing this again to see if it's actually going to work. Let me see what's actually going on. What's actually going on? Can I? Okay, let me see what is going on. What is going on? What is going on? Can I find this? Can I find this? Mm, okay. Okay, so let's see. Share. Let's get this copy. Let me see if this is actually working better this time. Because unfortunately, after everything, it did not work. Life is funny actually. I've set up everything, and at this particular moment, is the time that he decided that I wanted to go out. So what can we do? Nothing. Not sure why it's not working, but so yes, I have to say this for another day. Nothing else I can do about it. But for now, we're just going to answer some of the questions that have already been sent in before, and then move from there. Move from there to the other thing. So I'm doing a few minor shares, which is the funny thing about things like this happening is just that you do all you can to test run. But then devices are devices, and when they happen, you deal with it from there. But what we are going to be talking about today essentially is IVF. That is what our whole conversation is. IVF. And from that point, it moves us to the next thing, which is that what is IVF? Just what is IVF and all of that. So let me see. Um, yeah, sounds. Okay, so actually, this one is actually working, which is good. Oh, thank God. Thank God, thank God, thank God. So, uh, okay, add issues with the last link. So, thank you very much for your patience. It's just how life is sometimes. It's just how life is sometimes. I've been trying to, I scheduled everything and all that, but unfortunately, just as life goes now, unfortunately, ah, unfortunately, decided to go out. The solar is being replaced, and it's all of those things, sha. But essentially, what the idea is that we're going to be discussing about IVF. The goal is to answer whatever questions you have. If you have specific questions, some persons have already sent in their questions before, which we are planning to use as a way to actually navigate through everything that is actually going on and answer those particular questions. And okay, sorry, some people are still telling me that that was sound. So I'm sending it out now. So this delays it's Nigerian situation actually. Give me a minute. Like I was saying, it's Nigerian situation actually, where anything can actually happen sometimes, and it's very annoying. But what to do? Uh, what to do? Thank God, thank God. I'm getting messages that you can. So please, you can drop your messages for all of you that are here right now. I want to definitely ensure that I answer your questions directly for that. I was trying to actually explain the IVF process from beginning to end, so that you actually get what it is in case for the few persons that do not know, because some persons don't even know. And if you have any questions about your own particular peculiar situation, you can send it to me here, or you can send it to me on WhatsApp, so I can answer for you. For example, somebody asked me, what is the process of IVF, which is why I was answering the one I was answering before. Because the process of IVF is convoluted but straightforward. The first thing that everybody needs to do, the first thing that anybody needs to do is to go for your screening first. That is step number one. That is what guides us towards the thing that you can actually do. What are the steps that you can actually take? How can you really navigate it? That is what the first thing is. When you've done your screening, first of all, when you've done that screening that you have done, then that now moves us to the next point, which will now be, what can we do for you? Greetings, greetings. Nice to have you here. What can we do for you? And it depends on where the problem is actually coming from. We divide the causes of getting pregnant into three major levels. We say, okay, the first thing is the infertility that is caused by males. We call that one male factor infertility. And when we are dealing with male factor infertility, what often happens is when we're dealing with male factor infertility, what often happens is that there is an issue with the semen, the sperm. Some people have low sperm counts. Some people have no sperm at all. If you have low sperm count, the first course of action that we actually would, this tell me if you're having any issues with the fan, because they are working on the solar system and the other things, and so because of that, I cannot have the night the way we want to. But it's alright. It's to improve the whole service that we give. But because of that low sperm count, now it's impossible for them to actually get their wives pregnant or get their people pregnant. And because they're having that issue, there's no way for the sperm to do what it has to do. So we give them medications as the first level. There are different kind of medications that can be used. A lot of people used to used to the what the medications may be now if they are dealing with actually they're actually dealing with low sperm count. But there are some persons that despite the medications that you are giving, there are some persons that they are not going to respond to those medications. That is just the truth. What will happen is that you give the medications, there's no response, and because there's no response, you now have to move on to something else, realistically speaking. For some of them, we now have to move on to the procedure we call IUI. IUI is intrauterine insemination. Let me just type it out here. So you can check it out later in case you have questions about it. Intrauterine insemination. Insemination, which simply means that we collect the sperm, collect the egg, and then put it into the woman's. We collect the sperm rather, sorry, and then put it into the woman's womb. That's what it is. For some persons, you can use their sperm like that. But those people are not usually the people that have low sperm count issues. Then for other persons, you have to prepare the sperm and boost it in a sense before you can use it for that intrauterine insemination. But IUI often works best for women that are in younger ages. It's not the best thing for women that are at menopause. In fact, above the age of 35. There are some people that even above the age of 30, you cannot do it for. So you have to do your screening before going there. And in IUI, we now have two options. Can we boost your sperm and use it? Or do we have to move to the point whereby we have to get a donated sperm? And the truth is that it happens like that. There are times whereby you have to get a donated sperm. And there's no problem with that one. It's just the reality of life and all of that. And we have the ways that we actually navigate those kind of things. Those are some of the actually more affordable options that you can use to get pregnant. But if you say, okay, I don't want an IUI, I don't want a donated sperm, or I'm above the age that I can actually do an IUI and I want a good chance of success, what can I do? Then it now moves to the next one, which is that you can do an IVF. But even in that IVF, can we use the man sperm directly? Is a question. If we do what we call washing of the sperm in a way to get the best one out of it, can we still use the man sperm? That is the next thing. If the answer to those ones are no, we fall back to donor sperm. Okay. Then we now move from that one. That's the main factor. If it's azoospermia, which means that there is no sperm at all. If there's no sperm at all, then the next thing that has to be done is we have to see if we can extract the sperm directly from the man's testis, which can actually be done. You can collect the sperm from the man's testis. If we are collecting the sperm from the man's testis, we call that one tessi or tessa, depending on where you are doing it, and or the procedure that they're actually doing for you. But some men, you do that and you still don't find anything, which now means you have to go to the next sperm. That is for male factor. Sorry, let me answer this question that this person asked first. Oh, is what are the chances of somebody diagnosed with azoospermia having children? That is the question, and that is what I'm actually answering. So for that azoospermia now, they have to do first thing. What is the cause of the azoospermia? Is it that there's a blockage? The man is actually producing the sperm, but there's a blockage of the tubes. If the man is producing, but there's a blockage, you can do something. If the man is not, if there's no blockage that there's actually no sperm, then it's a donated sperm situation. It has to be a donor sperm. And is IVF possible? Yes, IVF is possible, but with a donated sperm. Then the other question that came in, the person asks locations. Currently, I'm affiliated with three clinics majorly, while we're still adding some other areas to allow people that cannot come to these areas to actually have access. The first one is I have an affiliation in Warri. I have an affiliation in Port Harcourt, in Abuja. There's actually one in Lagos, but it's a bit pricey for a lot of persons at the moment. Persons are a bit pricey for a lot of persons at the moment. So I'm still sorry, excuse me. I'm still looking at that one to see how I would navigate it. But the IVF clinic in Port Harcourt is Arumi Bekwe called Fertility Clinic. The one in Abuja is Amoni Fertility Clinic is at Asokoro. And the one in Warri is First Rank Hospital Giwamu is at Airport Road. Those are the three locations I'm majorly affiliated with now. What I'm going to do, what I intend to do, will be to compile a number of them, get them together, and I want to have a number of places that you can go to because not everybody can come to Warri, not everybody can come to Port Harcourt, not everybody can go to Abuja, and it has been causing some kind of friction because some people are not able to actually follow. Uh, yeah. So some people are not actually able to come to those places, and we are trying to actually get more so that you can have access somewhere in the east, more in the west, deeper in the north. But when people reach out to me, except for people that are maybe in Niger or close by, they find it difficult to come to the Abuja center. Okay, the Abuja address. Let me just okay. Well, let me give you a link that you can directly send me a message on WhatsApp in case you don't have it, so that with that I can directly answer those questions. I think what I should have done would be okay. All right, all right, all right, all right, all right. Let me see if I can copy this thing more. Let me see if I can copy this link. Okay. I think I'll need you to help me do something. I need you to help me maybe answer some of the questions and do something. Log in to the live on your phone. How are you going to do it now? Yes, so that you can, as they're asking some questions, I'm trying to get, and just help me answer them. I have to be with this one because of the fact that I need to. You can use this one. You can. Okay, have you found the channel? Have you found the channel? Finding the channel is the first thing. Get it. But if you go to my YouTube there, you can use any other one of my other accounts and log in. Okay, let me see. Control V. Does this change now? That did not work. Yes, I just started a new one entirely. Yes, we have. Yes, I am. Okay. Control V. You can reach me with this link. So use this to reach me on WhatsApp while we're answering the other questions for you on WhatsApp. Reach me on WhatsApp. On WhatsApp. This. Okay. Then you can reach me on. So for the number I'm putting now, what I would like to 0915 914 0474. So you can send a text message. So I'll send you the link to the Abuja address. We're going to try and post it on the group chat on this particular chat, but I don't know if we would achieve that before the end. All right. Okay. But is at Asoko. Let me sorry. The goal is to answer as well. So if you have any questions, please ask because I want to get ensure that all questions are actually answered for everybody. I don't want anybody to go with any questions that they have here. All right. So let's see. Yeah, what's the next question? Yeah. Mm, mm, okay. Mm, this was meant to be, and I cannot even send the messages across to everybody again because it takes thousands of persons, and so you have to turn off yours. All right. Thank you very much. Okay. So that is for I think that is the question for the address. Then the other question that I often that I get asked is what is the cost of IVF? What is the cost of IVF? That question is direct but also scattered because it depends on your location. It depends on what your situation is. It depends on what you need. But I just got that same question I asked. So you're speaking. What is the present cost of IVF? It's one of the most common questions. It's one of the most common questions. And I will tell you what the costs are at the centers I'm affiliated with. Then I will tell you what the cost can actually be at other centers. I actually had, okay, so, okay, yes. So I'm coming to your question, Mrs. For sorry, I'm coming to that question. Let me answer this cost one first. So for most people, the cost, the kind of IVF they will need will depend on the age of the woman. if the woman is young at the if the woman is young at about 45 years of age, what actually tends to happen is, sorry, if the woman is young below the age of 35, borderline 40, we tend to be able to use the XYVF, which greatly reduces the cost of the whole thing. Yeah, what it is. But if the woman is above the age of 40, sometimes even above the ages of 45, their air quality drops so low that is impossible for us to actually use that egg. And when that happens, we don't have any other choice but start continuing donor egg. And if you are using your own egg, your own sperm, or a donor egg, a donor sperm, that will affect the cost of what you are getting. For example, let's talk about the centers I'm affiliated with. Most of them, the basic cost of IVF for them is between 1.8 to about 2.2, 2.1, 2.2 million for the basic cost of IVF. That you are using your own egg, your own sperm. But if you are now going to use a donor egg or a donor sperm, it tends to go higher to about 2.3 for example, the center where a donor egg, donor sperm, a donor egg is about 2.3, 2.4 million naira. In Port Harcourt is about the same range. In Abuja, it's actually about the same range, but the Abuja center is the center that is currently on a promo, and because they are on a promo, they are currently doing the entire IVF procedure for 1.8 million naira. So from the beginning to testing to everything, 1.8 million naira. That's what their own currently is. Mm, okay, okay. That is what their own currently is because of the fact that they're actually doing a promo. Also, that's how the cost of IVF can vary. Then, okay, so that's what that one is. Then we'll now go over to the next one. Somebody asked, "You have tried IVF twice because IVF can fail." I wish it wasn't so. I wish it wasn't so, and a lot of times it's very sad that it actually happens. But the truth is that IVF can fail. And okay, give me a minute with the last. Okay, so okay, I think what I'm going to even do is to schedule this thing for maybe tomorrow or Monday and get it done again and see what happens from there. But let's know from there. Okay, I'm coming to the problem. Worry. So it says she try IVF can fail, and it's a reality. Unfortunately, we don't have any center that has 100% IVF success. I wish we did, but we don't. It's not obtainable in the world because there's still a lot of chance happenings that happen into it. You can do the best things for the procedure, which is what we try to do. We use the methods that we have used before that actually work. We use measures that we have used that work, and then you go in and there are other factors that may come into play that can now cause failure. But the reason why we keep on doing what we do is because the processes are being refined consistently to get a higher chance of success in every IVF cycle that you do. Apart from being refined consistently, the next thing that is also happening is that IVF usually comes in as a point whereby the person that is there may have no other stress. The person is probably not going to get pregnant at all. There's no way for the person to get pregnant, but thankfully and luckily, we have come into this and the person cannot get pregnant and you move from there. Then we now go to this question that the person has asked. He said they tried IVF twice and it failed. And after the failed cycle, noticed that there's a fibroid 4.1 cm and 1.7 cm. Please, what can be done to test positive in another cycle? Okay, to start answering this question, we have to start with the question of how does fibroid how does fibroid actually affect your IVF process? That is the first question. The fibroids on their own are not a problematic thing on their own. eh, are not a problematic thing on their own, fibroids on their own. The truth with fibroids is that 50% of women or even more have fibroids per time. That is the honest truth of the situation. They actually have fibroids per time. But because of the fact that the fibroid is there in 50% of the women or more, we find that it does not necessarily mean it causes a fertility issue. But when it causes fertility issues, for example, if the fibroid is large, let's say the fibroid is something that is very big and it's not going to, the fibroid is, this is the size of your, this is how big the size of, if you are with me, you can just do something like this. Are you seeing this? For everybody, this is like the size that their womb is supposed to be because we say it's the size of your hand. So that's what it's supposed to be. It's supposed to be below your pelvis. You cannot even feel the womb. You don't know that the womb is actually there, what is actually happening. That should be what is actually going on normally in fibroids when the womb is normal. But in a fibroid situation, this fibroid starts occupying spaces. So you see a woman that have you not had? Oh, okay, maybe you will not notice because for us we do. You may see a woman now that has been pregnant. She tells you she has been carrying a pregnancy for 10 days. Sorry, 10 years, 2 years, 3 years, 1 year plus. She has not given birth. It is because a fibroid, not a pregnancy, and that fibroid has become so large that it's as though the woman is pregnant. She becomes as though she's 9 months pregnant, and that kind of there is no way that kind of big thing will be in the womb and the woman will get pregnant. So that one has to be removed. There are some of them that are very small. On a normal day, they are there, they will not cause issue. But here they are. The womb is okay. Now I think I need something to draw with to actually illustrate this point. Okay, I hope you can see. So the womb is, think of it like this circular pear. It's not showing, not showing. It's not, I don't think you can see it. Okay, now it's showing. Okay, think of it like this circular pear that has two pipes, then a funnel that the sperm, the sperm comes in through here. This is where this is where the vagina is when the man you're having sex and ejaculate inside. This is where the sperm is supposed to come through. So when the sperm comes through here, it's going to climb here, swim outside here, to come and meet something like is there's like a storehouse here, two storehouses here that are the ovaries. It comes there. But there are some fibroids that though they are small, they will not be somewhere like here. They are small, oh, but they are here and here, and they now block the flow of the sperm. So the sperm comes here, it cannot pass. It comes here, it cannot pass. That is problem number one. Number two, sometimes the egg that is here is supposed to come back here inside here through this place. The egg that is here is supposed to come back inside through this place. They don't have a passageway. So that kind of situation, a small, even if it happens to be a small fibroid, that kind of fibroid will now cause issues, even though it's small. The other one that I was talking about now, it will now grow so big that it now starts covering everywhere. Inside this spoon, then this middle, there's supposed to be a place here that the baby will grow inside. But the fibroid is now going to take up that space. And after it takes up that space, the woman cannot get pregnant. That's one. Then that's why when it comes to the question of sizes, you cannot just say that because the fibroid is this size or that size is because of the issue. But there are some that you see. Okay, I had a patient yesterday now. She had the fibroid was about 10 centimeter by 13 centimeter. To put that one into context, what that means is if you use your fingers in medicine, we count it as each of this one is 2, 2, 2, 2. So this is the length of the fibroid. Then this in the same direction is like the breadth of the fibroid. So the mass should be something like let's say something like this. All things being equal, inside something that should be something like this is bigger than it. That woman cannot get pregnant without taking out that fibroid. For this situation now that you have tried IVF twice, um, there could be a possibility that the fibroid is the cause, 4.1 cm, 1.7 cm. But the question is, where is it located? If the fibroid is the cause and it's actually located at a point that is preventing the baby from growing, it has to be taken out before you can have any success. It has to be taken out. But if the fibroid is not the cause, then you have to look at other questions. What is the quality of your eggs at this point? What is the quality of your husband's sperm? Are they okay? There are things to look at. Because if it's a problem of egg or sperm quality, you can circumvent it by the option I know you would not want to hear, but the option it might be a donor egg or a donor sperm. Sometimes it can also be the woman's body. We have this in IVF where people are scared of failures, but we don't necessarily categorize failures in IVF as a waste. Because after doing that stimulatory process, we have placed you through those medications and now stimulates you. What can now happen is that you would be in a state of being able to get pregnant faster, and the next cycles may be a success. But there are some rare occasions, in all sincerity, that we're here for a live conversation. And to be honest, there are some rare occasions where what actually happens is that a woman may try IVF multiple times and not get pregnant. And for those kind of people, we'll now move on to the option of surrogacy, which is somebody is carrying the pregnancy for them. If they're at an age where they can actually, if they're at an age where they can donate their eggs, and the person carries it with their eggs and their sperm. If they're at an age whereby they can no longer donate their eggs, they can no longer donate their sperm because of the issues that are ongoing, they'll have to use a donor. Those are conversations that now have to be had. Okay, let me pin this for is okay message. Okay. Then moving on to okay. Then yes, there are for some of all these things, there are actually videos on that you can actually see for fibroid, low sperm count. You check, you see I've answered questions on those on the channel. Then okay. You yes, promo actually happened in worry. They do happen in worry. The thing about the promo situation, the honest truth about promo situations is this: do your IVF when you can. Last year, the promo in Warri for IVF was about 800,000 naira, 900,000 naira. That was the entire procedure from test to the procedure, everything. That was actually what it was. But when our president came into power, Tinubu got in, things started skyrocketing. Remember that exponential increase in the price of everything, things started doubling, tripling, and all that. When that situation actually came on, it now meant that the hospital that was doing a promo could not keep up because they had charged a price that was so low and they could not maintain it because for the worries and what we do is we're sure all the centers, the drugs are imported. All the centers that I work with, the drugs are imported. The drugs are imported and we have to keep on importing that drug despite the increased cost of the medication. So we refused to start going for substandard options that are going to be cheaper. And that meant as dollar kept on rising, the cost started going because of running the IVF. So it became a problem. They found it very difficult to balance that out. And because of that, there have been some holdbacks on promo for the meantime. But I know that there is a conversation in works for a possible promo later on. But the reality of what now happened in that situation was this. Okay. Okay, I'm coming to that question. But the reality of what now happened in that situation was this. If the person that waited for the promo that now happened after all of this hike, where the cost of doing IVF there was now about 1 point, was it 1.3, 1.4 million naira, was paying more during that promo period than the person that would have done the IVF normally without waiting for the promo. Because the normal cost of the IVF the year before was about that 800, 900, maybe 1 million. But going forward, the promo now became such that, sorry, please, just send me a message. Send me a message. Please text me. Text me, not calls for now. Yes. Text or ask. on the live. People that are here, I am prioritizing their question over other person, so it's just reality of things. Huh? Okay. Yes. So the problem where I know that there's a conversation about it. I think it's going to be happening something maybe about. I cannot say for sure. It all depends on the number of factors. But let's say something July, August, there about maybe when the promo actually happens. Don't worry. Abuja is one having their promo now, 1.8 million naira for the entire procedure. Worry, I'm not sure when it will be, but it's coming. It's coming up. But if the best is to do it when you can, because we don't even know if things are going to go higher. By the time you wait for the promo, you're going to be paying more during that promo period than you would have paid if you did it normally now because things have gone up. So do it when you can. That's my best advice. Okay. The IVF Center in Abuja, they offer treatment to couples to try naturally. Okay. Okay. Did they offer please just answer this person quickly and give me back. Just talk to her. Then she can ask the question here. Okay. No, no, no. Everyone, answer her. Let me know what it is, so that if she has a question, she can type it. I'll answer it here. For the reality of things is, for every one of the centers, they are not an IVF center. They are a fertility center, which means if you're having, where is she? Where is she from? There's one in Port Harcourt. Let her send you a message. We'll respond to her later, or she can send a message here. There's a center in Port Harcourt. We can connect her to that later. Yeah, all of them are fertility centers, which means if you have an issue, yes, I'll send. You can connect. Yeah, but let us ask her questions here because it's on the live. She cannot be priorities here. So there are fertility clinics. If you come to them, what we're going to do is work towards getting you pregnant. We're not trying to. In fact, we're very very slow. Or call back later, not now. We are very very slow to go into IVF. We'll only go into IVF if we know that that is the only option that you have. That is the option that you have. That is when. Okay, Mr. For send me your scan results. Send your scan results to my WhatsApp number using that. Let me see. I'll sit and we'll have a conversation on that and see what it is on how we can navigate. Depending on your location, I can visit one of the centers. Then we'll see how we navigate that for you. So if you're having just when we usually advise you to come to the hospital for fertility issues, it's very straightforward. You are a married couple. You are a young couple. For young in this situation, I'm telling you that you're below the age of 35. You're a young couple, you have tried for about 1 year. 1 year of a sex whereby the man is pouring the sperm into your body. That is the 1 year we're talking about. Oh. The sperm is being poured into your body, and as it's being poured into your body, you are still not ejaculating. The ejaculation is happening into the woman's vagina, and it happens at least 3 to 4 times a week, preferably 3 to 4 times a week. Oh, and that sex happen every time, every week, which means you are basically meeting during the ovulation period, after, before, and you have tried. Let me see. Mm, okay, okay. I've answered some of these ones. Uh, I've lost my train of thought. Especially, we are trying to get you pregnant without IVF if we can. If there's IVF, if it's IVF that is the option, then we'll go there. But we'll always try for IVF is a second to last resort option. It is you come in, fertility screening, lifestyle modifications. I've had couples that have come in because of the fact that they're unable to get pregnant. And the only problem that they have, this is usually for younger couples, the only problem that they have is they are not meeting at the right time. They are meeting outside of ovulation. Maybe the husband is not located at home or what's not the other. And because of that, they now have to move to another point and come to us. We tell them how to calculate how to do it and get pregnant. Practical examples, yes, it seems like it's impossible for you because you probably know your cycle and all this things, but it's a reality of life. Because of what is happening, we show them they get pregnant. That's step one. Step two, we now move on to maybe medications. You're having hyperprolactinemia, some kind of hormonal imbalances, we place you on drugs to get pregnant. There's a patient that we had, for example, in the UK that she sent out a message and told me she wanted to do an IVF. She had been trying to get pregnant for a long time, and this and that, and this and that. And she wanted to come back to Nigeria. So that no, wait. She gave us an answer. She was willing to, if we had said come down this month, she would have. But because our priority is not an IVF, our priority is of getting pregnant. We told her to wait, so that I would prefer for her to be on a certain medication for about 3 months. See, because our situation was PCOS, she responded to the medications we gave, and she got pregnant. She sent me a picture. Oh, unfortunately, it's difficult for me to now show you, but let me see if I can find this picture now. Okay. Send me a picture of the baby. The baby has been delivered. The baby is looking very, very good. And she no need to spend the money on IVF that she wanted to spend because, like I told you before, the priority is not actually IVF. The priority is that you get your baby. Oh, I did not take her permission before doing this. I cannot actually show you the baby because I did not get her consent. Sorry about that. Then somebody asked again. Let's see. Fibroid growing outside the womb. For fibroid growing outside the womb, it also depends. So most of them, those are what we usually call pedunculated fibroids. For pedunculated fibroid, the major problem that they have is when they are very, very large, so large that they can now start compressing the womb of the woman, even though they are not inside of it. That is it. Then also it now comes down to location. It now comes down to location. That one also comes in. So that's it. Then said I was going to answer some things. Give me a minute. There's some other questions that actually came up before. So I was going to go through. Okay. Um, okay, surrogacy. Surrogacy is also an option that you can actually take. But like I said before, in the tiers of rest of what to do, surrogacy is an option that comes on after IVF. So coming, lifestyle modification, drugs, IUI usually is the next step. IUI, if that is where the problem, we collect the sperm from the woman and put into your body. IUI usually is the next step. And after IUI, we now move on to the next one, which is now the IVF. After IVF, welcome to everybody that is just coming in. Please, if you have questions, just drop them as well so that I can answer your questions. You that is here is a priority for me. And once again, thank you for being here. Thank you for being here. And thank you for sticking despite the initial issues that came up. I'll have to reschedule for the many other persons that are unable to be here because I know that a lot of other persons actually wanted to be here, but unforeseen events actually came up. So after IVF, surrogacy is not an option. Then the last tier option is adoption. That is what it actually is for us. So then, okay. Then somebody, then the next question that was asked said, let me see what this question is. Since she's 57 years old, no longer menstruating, what she want to know if she can do an IVF. The answer for that question is that age is a peculiar one. If you have stopped doing seeing your menses, generally you can do IVF. Yes. If you stop seeing your menses, generally you can still do IVF. But the reality of you stopping to see your menses is that in that situation, our option is a donor egg. Why is it so? When menstruation has been happening throughout a woman's life, it's because women are born with a certain number of eggs from the beginning. They're born with a certain number of eggs. When they are born with those number of eggs, every month that they are menstruating, some of that egg is being depleted. You cannot refill it. Oh. I know you have heard of egg boosting and all those, and I talked about giving a woman medication that she produces more eggs, but you cannot refill that one that she was given with at the time of her birth. And as she's getting towards the age of menopause, that egg starts reducing. That egg starts reducing. And by the time she gets to menopause, what it means is that she has exhausted her stores. There is no way currently in the world, there is no way that the woman that has stopped having her eggs now will now start to give her medication that she now produces the eggs again for you to use. So when it comes to menopause that has occurred, this is for both menopause. Okay, there's early menopause for some people that are young. Yes, they're 25-year-old, 26-year-olds that are actually experiencing menopause. Some of them they're experiencing menopause because of hormonal issues that we can give medication to adjust. But I'm talking about medication now in this woman that is 57 years old. I mean medication in this woman that is 57 years old. We don't have what we can give to her right now in the world that will make her to start producing the eggs and now start getting pregnant again. No. If we want to attempt IVF for her, it will have to be with a donated egg. But the other factor to consider is that the chances of IVF increases with younger age. A woman at 25 doing IVF, yes, there are couples that are 25 that need an IVF. A woman that is at 25 doing an IVF has a higher chance of success than a woman that is at 45, which is one reason why we go for donor eggs. Studies have shown us that if you are using a donor egg and you use the donor egg of someone at a particular age, you are giving that person the chances of that age. So a woman at 45 that is using the donor egg, somebody that is at 25, because 25 to about 30, they're about they have about the same chances of success. A woman that is at 45 that is using that kind of egg, you are increasing her chance of success, reducing it from the lower chances that she has before to a higher one, giving her a better chance of getting that pregnancy. But at 56, 57, egg quality is low. What is the outlook on the womb? We have to know by screening. We have to do some other testing. Some couples, for some, generally above the age of that 55, 60, 56, 57, we generally don't recommend doing IVF. What we usually recommend at that point is surrogacy, because you have to take the body through a lot to get it to pregnancy. It's not impossible, but the chances are slim at that point. Then okay, let's attend to the next question. Said okay, I think I've answered this. Is there anybody here that does not know the meaning of IVF? You don't know the meaning of IVF, you don't know what IVF is, just leave a comment here so I can see. If you don't know the meaning of IVF, you don't know what IVF is, okay. Do you know? So if you know it, just say yes. If you don't, just say no. If there's a no, I'll respond to it. The meaning of IVF. IVF. Okay. Now, can ASAS do IVF? Can ASAS do IVF? The answer to that question at a point blank level is yes. But they have to consider a number of options. The first one is this. Okay, let me just ask. I want to know if there's is anyone okay. Just I think I just react to it if you are ASAS or something, so I will know what it is. But let's just answer the question. That's the purpose of being here. ASAS for ASAS, we have a number of varied options. We are going to talk about them. We are going to talk about them based on cost. The first option for an ASAS couple is the unpalatable one, the one we don't like separate. The second option is don't give birth, unpalatable option. So we'll now come to what IVF can do for them. Huh? Okay. Okay, I'll respond to her. Okay, thank you. So for that one, for the first option is that yes, they want to get pregnant, but they cannot just randomly, but they, but they cannot just randomly get pregnant. So the first thing they will have to do is they would come to the hospital, then we'll do what we call an IUI. That is the cheapest hospitality that they have. But the problem with doing an IUI as an ASAS couple is that for an ASAS couple, the IUI that is done has to be done with a donor sperm, a donor AA sperm. That way, what will happen is that the AA is the one that is meeting with the AS. So they can get an AA child, they can get an AS child, but they cannot get an SS child. That's what that one is. Then let's say the man now says, because men are very resistant to this option, I want the baby to be mine. I don't want to use another person's sperm. If I use on that person's sperm, is it my child? You now go to the next option. For that option of that one, that IUI option, usually the cost can range from about, depending on your location, or all these things are largely depending on the location here, location in Abuja, location in Lagos, they are very, very different. An IUI can range from 350, 400,000 naira to even a million plus, depending on where you are. That is grade one option for ASAS couples. Then ASAS couple, grade two option. Well, you want to use the man's sperm, so no problem, fine. You want to use this AS sperm. That means you need an AA egg. So the woman is not the one that will do IVF and get a donated AA egg, which now brings us back to the average cost of IVF, where you see IVF running from about 1.8, 1.9, 2 point something. There are centers that do IVF for 4 point something, 5 point something million. And if you're not using donor, it means it's going to be more expensive. So they are going to be using, it's going to be more expensive, which means they are going to be doing maybe 2.5, 3, 4, 5, something like that, depending on where you are actually. That is what they are going to be doing for that situation. So that's it. The other options that are available but are not readily available in the nation is something like pre-genetic screening, which yes, in fact, that actually comes into a way that they can use their eggs and their sperm. For pre-genetic screening, what we do is you collect the sperm and the egg, fertilize it in the lab. The babies they start developing. We'll now collect samples from these babies, take them to the lab and check which one of them is. Sorry, excuse me. Which one of them is SS? Which one of them is AA? Which one of them is AS? I will not transfer just the AA spends back. It is still the same principle that we do gender selection. Which one of them is male? Which of them is female? And transfer that male or female one back into the womb of the woman. Therefore, whatever X now takes is an AA egg. Whatever X now take is a male or female, depending on what your selection is. Then there's the other option of pre-genetic screening that involves sampling. The woman is pregnant, to take a sample from the pregnancy to check if the woman is if the woman is if the baby is AS, if the baby is SS, the baby is AA. Ideally, the baby is SS after taking that sample at about 12 to 20 weeks of the pregnancy. It is terminated. We don't usually do that in nation. We have some laws and some other things that also come into play. But the major factor is cost. If you are doing pre-genetic screening, the cost is running up to 7.98 to about 10 million naira plus. Can run up to if you are doing pre-genetic screening. So that's why it now becomes more affordable to either avoid it entirely, consider IUI options and all of those other options that we've actually discussed before now. Then, hi ma'am, I'm Joy. It's my pleasure to answer your question. You're not seeing your message for now. It's unpalatable to hear this. I wish I never have to say this to anybody, but if you're not seeing your menses, then it means that you would have to be used to use a donor egg for your IVF. You can still get success. We have couples that are 50, 51, 52 that have gotten pregnant with IVF and have even given birth to multiple pregnancies, twins or triplets, and the like. That has actually happened. It's the reality of the way things are. Then okay, according to your doctor's report, both tubes are blocked. Can you still do IVF? In fact, IVF was made for you because normally, like with that diagram I showed you earlier, for those that saw it, okay, can see this. Ah, this looks so rough now. Well, okay, so long as you can understand what we're saying. This is the funnel that the air that this is the funnel that the sperm comes in through. These are the tubes that is going to go out through to go and meet the egg storage unit or where the egg is being stored. But now in this situation, this is being blocked, it's cut off, this is cut off. So it means that there's no way for the sperm to go out, there is no way for the egg to come in. So they cannot meet. In that state, the woman cannot get pregnant. But in IVF, we don't need the tubes. We are collecting the egg from the body, collecting the sperm from the man, taking them together to the lab, fertilizing it, and now using it to get the woman pregnant. So if the tubes are blocked, there's no issue. So long as you can come for the procedure, you are within a good age and all of those things, you can get your pregnancy and move on. That one not even a problem at all. How to reverse PCOS, food to eat to overcome it, and when I need what I need to do to achieve pregnancy. Okay, there's a video here about diets. There's a video here about diets. So just check around the channel. You see a video about diets that you can eat for fertility based things. But diet is not just enough, but something that you can consider. For PCOS, it depends. We don't do what we call reversing PCOS in the grand scheme of things, but PCOS can have some management. For a number of women, they can undergo medical management. There are certain drugs, certain medications, and they get pregnant. For a number of women, but sometimes PCOS is now amenable to medication. That now means that we have to now move to the next point, which is the point of using IVF or IUI or some of those things to actually navigate the situation that is there. I think we've gone on for some time. This is about 48 minutes. In about 12 minutes, we'll round off so that we'll finish at the hour mark. And I think I would attempt to reschedule, let's say by tomorrow will be too for us because I will not be able to get the message across to everybody. So possibly by Monday. Let's see how Monday goes. That's what we'll do. So but now let me see. Okay. I'm 50 years old. I've been trying to conceive for 15 years now. My menses stopped since last year. In the last 2 years, I've tried IVF 3 times and all failed. I don't know how you can help me as I still desire to have children. Okay, for this situation, sorry about your experience. I'm really sorry about your experience. That is a very, very unpalatable experience. For most people, one cycle may not be it, but two, three cycles they get pregnant, especially if they are not spread out. So if you are going for it, preferable not to spread it. But for some people, you might actually have sometimes you have experiences like this, and it's sad. For you, ma, from the bottom of my heart, I do wish that I could tell you that there is no I could tell you that okay, what it is you are going to. There's no problem. You can do the IVF again. You come and pay us your money. I will do it for you. I will get pregnant. But that would be a lie. That would be a lie. If you have actually done it twice at your younger ages till now and you're not getting pregnant, then my best advice to you would be consider surrogacy. Consider surrogacy as an option, yes. Consider surrogacy as an option because it might be better for somebody else. Like you don't spend the money again. It might be better for someone else to carry the pregnancy and you go home with your baby. People say, but if somebody else carries the baby, zero day my baby. Ah, you, the mother that is taking out the time to be here today, that has been to the hospital, that has been to see doctors, that has gone through the strain of trying to get pregnant for multiple years, and finally gets your baby, you will even appreciate that baby more than other persons that just got the baby. In fact, you have even put more of a seed, more of an effort into becoming a mother than many people ever have. So to me, you have paid your dues for motherhood, though. And when you hold that baby in your arms, when you hold your baby, ah, you don't see fathers crying, men they cry, they shed tears because they have been trying for years. So don't let. I mean, a lot of the factors of this thing is one, you feel like you want to must experience pregnancy, which is good. I understand it, but if you're having issues, instead of spending 15 years, get your pregnancy, get your baby. Your baby would have been maybe 10 years by now. Then going beyond that one, the other border is what are people going to say? What will people say? Those people are not with you at night when you are crying. They are not there. I had a patient and I was trying to ah she can't hear. Can you hear me? Is there still any issue with the okay, hear me? Can you hear me? Is there still any issue with the audio? Somebody said they can't hear me. Can you hear me? Please you have kindly respond to that. Let me just know. Yes. Yes. Okay, okay. I've gotten responses. Yes, you can. Yes, you can hear me. Okay. All right. So, like I was saying before, forget about what people are going to say. They're not going to be there with you. My patient was hanging clothes in her house because she had not yet gotten pregnant. This was before she got pregnant. She's pregnant now, by the way. Because before she got pregnant, she was trying to, have a lot of children around her, playing, neighborhood mommy, and all of those things. And the child did something. She disciplined the child. The person came and said, "That because then you not get your own." He paid her. She cried. She called me. She cried. She told me, "Oh, doctor, doctor, don't worry. We'll now go to the other one." She had an altercation with somebody. It was not even, it was unrelated to what they're discussing. Because you never born your own now. So forget about those people are not there. They are not going to be there when you are crying. They are not there when you are facing those humiliation. People are saying a lot of things. So forget about what people will say. If you know that you are okay with doing IVF, it is more acceptable now. If you know you are okay with doing IVF, you don't have any issue with it, go ahead and do it. Get your baby and move. Thank God, before now, years before now, if you are pregnant, if you cannot get pregnant, that's the end of it. You cannot get pregnant, sorry, that's it. But now we have options. If you cannot get pregnant, you can do an IVF, you can do a surrogacy, you can do an IUI, you can do this, you can do that, you are going to get pregnant, and you are running away from it. Advancement is coming. How are you talking to me now? We're not in the same place. It's advancement. Medical advancement has come and we're still working on more. We still believe that we'll get to the point in the IVF whereby we can assure you of about 70, 80, even 90, 100% success. It's not yet there, but I believe it's possible because everything has been achieved before now that was impossible, but now we can actually get there. So, then what's the other question? I think this may be one of the questions that will be rounding off with. Okay. Huh? Yes, yes, yes. I'll get back to them on that soon. Let them just relax. Sorry, still having to. That's one of the losses. Still having to navigate one or two things. So sorry about those disturbances. I would like to know if it's possible, if there's a possible solution for someone that her ovaries has been removed during surgery because of ovarian cyst. The ovaries are the points through which the eggs are produced. They are the producers of the eggs. If the ovaries are removed, the option for that kind of possible woman to get pregnant would be with a donated egg because she cannot produce her own egg. So I think yes, you can get pregnant. That is the solution, but the solution is going to be through. The solution is going to be through a donated IVF. That's what it's going to be for that kind of situation. That's what it is. So I think that answers that question. If you have any other thing, you can ask. And failed IVF and success. Okay, failed IVF. Okay, failed IVF. What next if my IVF fails? Okay, it's something I explained before, but like I told you, a failed IVF is not a loss. A failed IVF is not a loss. It is like clearing the ground for the next one. And I had a patient recently that had a failed IVF normally and is not pregnant with twins. Is it twins she's pregnant with? Sorry, sometimes it gets it because I know that there's a patient that is pregnant with twins, one with triplets. Okay, some I think more than one with twins, triplets. I don't, I'm trying to remember. Okay, no. So I'm trying to remember which one she is. But anyway, essentially what it is this. She's not pregnant without doing the next IVF because, like I said, an IVF is like making the woman's body to be in a pregnancy state. So, because of the fact that she did it, it did not work. She went to met her husband at 2 year old. She was of a nice age. She's not even of a nice age, she's about 40 something now, so it's not like very young. But the situations were right. The pregnancy stimulating drugs have been there, and the hormonal drugs have been there. She got pregnant, and that's what it is. So a failed IVF on its own is not totally a waste. Some people are scared that you can, if you want to spend that kind of money on something, why will you not be scared? But if you allow the fear to hold you, I had a patient that came in. She was about 30 years in her marriage. She had been hearing about IVF. In fact, by the time she started hearing about IVF, IVF was about 400 and something, 300,000 at that time. But she did not agree to go. She came to me at about 60 plus. There was nothing we could do at that point. There's nothing we could do at that point. The eggs were already gone, the womb, so it was just surrogacy. She had come earlier, we would have done it for her, she would have gotten her baby. Yeah. Then is it true that if someone is above 40 years, she can't use the S for IVF? No, it's not absolute. There's some truth to the statement, but it's not fully true. In fact, I find that there's a serious problem that we have. A lot of times, some of the things that are true are being misconstrued. People use them to not say other things. Usually, above the age of 40, a woman's egg quality starts to decline. It starts to decline. That's the truth. It starts to decline. So because it starts to decline, okay, sorry. Okay, because it starts to decline at that age for most women above the age of 40, 42, you tend to need a donated egg because if you don't use a donated egg, they are going to have failure or the chances of success actually gets reduced. But we do an egg quality test first. Two things that matter: quality of the egg, quantity of the egg. So we do a test called AMH, which you have probably done. If you've not done, it's one of the things you do in your hormonal profile. We do a test called AMH to check the quality of the eggs and now determine if that woman can use her eggs or not. If she can use her eggs, fine, we'll go ahead with the eggs. If she can't use her eggs, then we have to go with a donated egg for her. So the first thing above 40, this above 49 is very wide. I find in my experience that when I hear above 40, it's 45 plus going to 50. If above 40 is 41, 42, to your AMH, let them check you. If it's 48, 49, it's unlikely that your egg can be used. It's likely going to be a donated egg that will be used for you. So I think with this, we have rounded off on the questions that I've had for now. So let me see if anybody has sent a question on WhatsApp. Okay, I was the one asking. Mhm. Okay. Sorry, somebody that asked a question here sent a message. I was saying, but it's not for general group. I think what I'll do now is I'll round off. I've put my link to my WhatsApp, my phone number. You can reach out. You can follow on the channel. I'm going to have to reschedule this because a lot of persons are not actually. And I'm actually happy to have been able to do this. I'm looking forward to doing this probably on Tuesday. Not sure about the time, but I'll pass the message across to actually answer more questions and see how we can regularly have more of these meetings. In fact, the goal would be to discuss some of these fertility centers, how to get so that you have more information about it. Secondly, I'll keep on answering more questions on the channel as we go forward so that people can more questions on the channel as we go forward. Uh, what? I'm coming. Okay. So that we can get you to have the answers to all of your questions and hopefully get to your baby. That is the goal. Get to your pregnancy, get to your baby, and complete your family because your family should be complete. You should have a child crying and disturbing you, your mom running around and I say, Junior, stop, Junior, stop. That is supposed to be for you. Thank you very, very much. Let me just end it with this. I'm sharing this for you. Okay, let's go through this. Attempt to do this. So, okay. Okay, so let's see. Okay, I'm trying to get something. Let's see. Okay, okay. So this is it's just funny how this kind of things happen. I should better see this already. Okay, okay. It's taking some time to connect. Can you hear this? Okay, this is one another thing for you. So I think with this, okay, let's just okay. So let's end off on that point. I'm not sure if you can hear me, but which one is better for surrogacy or IVF 44 years? Well, for chances of success, it's always better for a younger person to carry it, which is what surrogacy does. So that was surrogacy does. So somebody in about in their 20s, early 30s, carrying it is always better to do a surrogacy because they will have a higher chance of success. But it does not mean that you cannot get pregnant yourself through IVF. Just weigh your options, consider your finances, consider how open you are to trying multiple times. Even for surrogacy, sometimes you have to try multiple times, but you are more likely to get a success because the person is younger. So that is really what it is. If you can, ideally, what I would tell you is the surrogacy is the better option for chances of success. Emotionally, the IVF is better. Just evaluate what you want and have a wonderful time, everybody. Thank you for your time.